fellow learners, you have already learnt the importance of physical exercise in maintaining good health, and you have also learnt how exercise keeps us fit and we are able to perform all the physical and mental activities. By now, you must have also realized that whichever NCD or non-communicable disease we talk about, like cardiovascular disease, hypertension, diabetes, cancer or stroke, all share some common risk factors. And these risk factors could be modifiable, like the physical inactivity, unhealthy diets, stress, or they could be non-modifiable risk factors like age, genetics, ethnicity, etc. We shall now talk about physiological and medical benefits of physical activity. And for this, we have with us Professor Ramesh Agarwal, who is from the Department of Medicine, Lady Hardinge Medical College, New Delhi, who will be discussing and enlightening us about this aspect. Welcome, Dr. Ramesh.
Hello.
So, what would you like to discuss in this session or talk about in this session?
So, see, we already have learned about the risk factors which are contributing to the burden of the non-communicable diseases. So, I would like to highlight over here the role of the physical activity. So, like the physiological mechanisms of the physical activity which would contribute, the cardiovascular adaptations which we have in the body when we do a physical activity, the hemodynamic changes, the muscular and the metabolic and the hormonal responses which we have when we run or when we walk. Then the health benefits of those physical activities and the role of the physical activities when we do in the disease prevention, like in the context of obesity, diabetes, stroke, kidney diseases. So all this we will be discussing in the next few minutes.
That's really nice. So you want to discuss about physical activity. This is a very common term, but what do we actually mean by physical activity? Would you like to elaborate?
Yes, madam. So see, physical activity is something when you move from your chair, walk, and if I have to define it, it is any bodily movement which is produced by the big muscles of the body, which help in movement and which actually will require some energy expenditure from yourself.
So, Dr. is physical activity really important?
Yes. So, see, learners' physical activity in any form is very important. Just sitting and passing your time will not lead to your healthy life. So, if I have to summarize what is it important or not, it is said that lack of activity destroys the good condition of every human being, while movement and methodical physical exercise save it and preserve it. So, we must do physical activity.
Now, which diseases can develop in the absence of physical activity?
So, you see, physical activity is essential for everything. You name any one common non-communicable disease, and if you are not physically active, it is going to creep in. And if I have to name one, obesity is the mother of all diseases, and if you don't walk, if you don't do physical activity, just sit and eat, so the first thing which is going to develop is the obesity. You will put on weight, and once you put on weight, that means you are now prone to develop heart diseases. Heart diseases means that you will have hypertension or the raised blood pressure. Sooner or later something will happen, some say stress or some bad events. You may suffer from stroke, kidney diseases, and surprisingly, if we are not physically active, we may develop diabetes. So, and even cancer for that matter. So, this is the whole list of diseases which we can develop if we are not physically active. So, it's very important to be physically active.
So, that's a very simple thing. We don't have to do anything. It's not even, doesn't incur any cost. Just have to walk as you said.
And think and then walk.
Yeah. Okay. So, would you like to substantiate this with another studies or something?
Yes. So, if you are physically active, so studies have concretely shown that it can reduce the chances of dying to up to 30%. And it can certainly reduce the risk of developing cancers to 38%, cardiovascular mortality to say 20 to 30%, risk of getting infections from respiratory diseases like influenza, pneumonia, so they all can be reduced up to 40%. Dementias, which we suffer from the old age, so they can also be reduced with physical activity. Depressions, musculoskeletal fractures, the bone problems, osteoporosis, they all studies have shown that all can be reduced significantly if we are physically active.
So, does physical exercise help to keep our blood vessels also healthy?
Yes. So, again you see, if we are exercising, so that means we are forcing our heart to work more efficiently. The heart will pump more forcefully, and if it works and it forces the blood, so that blood will reach the vessels, the blood will reach the muscles where actually it is needed. So that is one way in which if we do a physical activity, it will reach the necessary substrates where it should be. So that is one. Another way in which the exercise of the physical activity helps is that it reduces the stiffness of the vessels. So I will give you an example, like if there is a clogged vessel, a clogged pipe say, and it is rusted, and if you push something with the pressure, so it opens up. Similarly, that happens with the blood vessels in our body. So if we are working, you're physically active, you're running, walking, whatever activity we want to do, so that will open those stiffed vessels. The third thing which happens when we do physical activity is that it actually increases the diameter of the vessels. So just imagine that you have got two vessels, two pipes, two drain pipes. One is a smaller one, is a bigger one. So which one will you prefer, the drain or the water to flow from a bigger vessel? So physical activity will increase the diameter of those vessels. So that's how the physical activity helps us in protecting our cardiovascular system.
All right. That is, I think you've really explained it well with the help of example of a vessel. Now, can the physical exercise also decrease the blood pressure? Because blood pressure is also becoming a very big problem with, people getting so much stress at their workplace, and reduced physical exercise also increases blood pressure. Can we reduce it with the help of exercise?
Yes. So again, this is a very important thing to realize, that physical activity, whatever we do, it is going to reduce our blood pressures. And it is not only in those patients who are suffering from the blood pressure that they are going to benefit, that their blood pressure will reduce. Even myself, yourself, and normal population, if you are doing physical activity, it is going to reduce the blood pressure by say 2 to 5 millimeters. And of course, in patients who are suffering from blood pressure, the blood pressure will reduce by about 5 to 7 millimeters of mercury. And in medical terms, that's a very good, significant amount of reduction in the blood pressure. So in a way, exercise and physical activity helps us in reducing the blood pressures.
Another very big problem, and I think what doctors recommend, is for diabetes. That if you walk, your blood sugar will also get reduced. So how, just physical exercise can even reduce blood sugar?
Yes. So again, this is another thing which we should learn, all those who are with me. You see, first I will like to explain you what is diabetes. So we must understand diabetes is of two types. One is type 1 diabetes and one is type 2 diabetes. If we talk of type 1 diabetes, there is a hormone in the body which is known as insulin. So insulin will metabolize the blood sugars and it will help us to prevent diabetes. So what happens in type 1 diabetes, that we have very less amount of insulin in the body, or in some cases insulin may not be present. So that is type 1, and that is seen in younger patients. Type 2 diabetes, there is no deficiency of insulin, but whatever insulin is in the body, it is not able to act. So why I am telling you this is that you have got insulin which is there to metabolize, but it is not acting. So how this physical activity is going to help? This physical activity will decrease the insulin resistance. So once this insulin resistance is decreased, the sugar which we eat will be metabolized in various tissues like skeletal muscles and other parts of the body. So in a way, exercise will reduce the incidence of diabetes. And this is very important for people who are in the stage of pre-diabetes. That is, they don't have a full-fledged diabetes, but they may develop diabetes if they do not do physical activity. So prevention of pre-diabetes, in developing diabetes, exercise will help. Another thing, madam, which you have asked me is that how diabetes is going to be controlled by the physical activity. So we take a blood parameter which is known as HbA1c, or the glycosylated hemoglobin. Now studies have shown that if we are physically active, the HbA1c, it will be reduced to the amount of 0.5 to 1% in people who do regular physical exercise. So what I have to translate this in very simple language, that if you do physical activity, your blood sugars will decrease by 25 milligram in your blood. So I think that's a very good amount of blood sugars which can be reduced, because the medicines you have to increase. So if you do physical activity, so this amount will be taken care by your physical activity. The third thing is that if you do physical activity, then the complications of diabetes which may develop in the future, that will also decrease. and the risk of dying from diabetes, that also is significantly decreased. So these all are the benefits of doing good physical activity in diabetics.
So you have given so much of information, and I think very important.
Yes.
So I will just again repeat, I think one or two things are very important. Number one is, by doing physical exercise, the blood sugar gets reduced, because the blood sugar which is there, excess blood sugar in a body of a diabetic person, that gets broken down and by the various muscles and tissues because of the physical exercise. And I think you will agree that we don't need to do very vigorous exercise, just brisk walking will also do.
Yes,
so that
that's
is
true.
also sufficient for controlling this, and also complications will be reduced, and you can lead a much longer and healthier life with diabetes. So I think that's very important. Now we also physical exercise can also help in our muscles and all, because sometimes post operatively we have seen that patients who are not able to start their physical activity after their surgery, they are bedridden for a long time, or even people who have got a stroke or something. So can physical exercise also help in increasing the health and the mobility of our muscles and joints?
Yes, certainly. You see, any sort of physical activity, I would like to answer it in a different way. If you're sitting idle for some time, maybe for a day or 2 days, what happens? Your joints will start paining. You will feel more lazier than what we usually are. So it is very important to move your body, to move that sedentary lifestyle, to walk, so that your all the muscles and the joints are in motion. And it is not necessary that we do a very brisk running or some sort of a jogging. That's okay. If you're doing it, it will add to your say calorie burn, or say other things, good health. But a simple brisk walking, that will also be going to helpful in some or the other way. So just don't think that if you're not capable of, say, running or doing some activity, so that will not going to benefit. It is certainly going to help you in your musculoskeletal system.
Another important thing which comes to my mind is that we have something called an endocrine system. That is a system in the body like cardiovascular, gastrointestinal. There is an endocrine system which has hormones, which produces hormones, and they have effect on all parts of the body, and a lot of different effects for growth, development, reducing pain, reducing stress. So can this hormone response also be modified, or can we change it with the physical activity?
Yes, certainly. So, see, there are the 2 or 3 things which I will like to say upon this question. One is the insulin, which we have already discussed, that how that insulin resistance is decreased if we are exercising. Then there are certain things known as endorphins, which are there in the body. So if you are doing physical activity, so these endorphins are released in the body, and which gives you a sense of relief from the anxiety and depression, which we all probably at some part of our daily routine we suffer. So if you are walking daily in the morning or the evening, whatever the schedule may be, so it will just give you a sense of well-being and will keep you away from depression, anxiety, give you a good sleep. So another thing is the various hormones which you are asking is, like hormones, there are very good hormones, and there are certain hormones which may influence some cancer cells in the body. So walking and these type of activities, they will help you in releasing the good hormones in the body, and will decrease the bad hormones, which can actually help in say cancer growth. So in a nutshell, yes, the hormones are influenced by our physical activity. It gives a positive response to the good hormones, and gives a negative signal to the bad hormones.
Yeah, because you very rightly said, that sometimes when you are stressed up, or even when you are depressed, in both situations, a physical exercise helps. I think everybody must have experienced that. Sometimes you feel angry towards somebody, but you just leave the room and go for a walk. It makes you, feel much better. So there is a scientific basis for that, as you have just now explained.
Yes.
Now we often know that when we do a physical exercise, brisk or a strenuous exercise, then we start breathing faster. So is there any changes which happen in our respiratory system also because of exercise?
Yes. So again, like what we discussed when we are talking of the cardiovascular system. So as we are walking or running or doing some sort of exercise, so we are respiring more. So respiring more means that we are taking more of oxygen. More of oxygen means it is going to be delivered to the lungs, and if they are going to be delivered to the lungs, in a way we are increasing our cardiovascular ability to pump more blood, and from the nose and from the mouth we are taking more oxygen. So our respiratory capacity is increased. And if you all remember those COVID days, then those who had a good respiratory capacity or the respiratory, the respiratory efforts were good in the patient, so those were better survivors than those who didn't have. So yes, respiratory adaptations are there when we exercise, and they are good for everyone.
That's nice. So, would you like to summarize, what are the benefits of physical exercise on various parts of the body?
Yes. So if I have to summarize, like starting from our diabetes, so diabetes is going to be really well controlled in patients who are diabetics, and even it prevent you from diabetes. Things like depression and anxiety and insomnia, so they are also going to be helped by exercise. Now, incidence of breast cancer, which is now so common, cervical cancers in females, so that is also going to be taken care if you are physically active. Now, cardiovascular system, as we have discussed, that it is going to, if you're exercising, the blood supply to various organs is increased, and risk of developing, say, strokes and heart attacks or infarctions, so that is reduced. And of course, it is going to give you the strength to walk, the strength in the old age, like, so basically you're investing your, this exercise in when you get older. So this exercise will going to help you at that particular time.
So, what is the effect of physical activity on mental health? We talked about depression and we talked about stress, but are there some other conditions in which physical activity can also help?
Like this, endorphins are very important in the human body, and these are released when we these are certain substances which are released in the body and give you a sense of well-being, and these have got a very say significant effect on the cognitive ability. By means of cognitive ability, I mean to say that like memory, recall, so that is also help. So you feel fresh, and you are able to be at pace with many of your colleagues, or say, and this thing is actually helpful in the older age, say when the things start developing dementias and cognitive declines. So your physically activity will also help you in that particular aspect.
Okay, so things like Alzheimer also,
Yes.
to reduce the chances of getting dementia and Alzheimer's,
Yes.
we have physical activity, it will be very beneficial. Now, we did talk about physical activity and stress and cardiovascular. Could you elaborate a little further on that?
Okay. You see, there is an increase in the rate of myocardial infarctions after a major event. Say someone loses a lot of money, and someone say have divorce or some other issues in their family. So they may suffer from sudden catastrophe like heart attack. And so don't you think there is something, some change happens in the body? So that change is a sympathetic activity in medical terms. Sympathetic activity means that there is some release of some hormones in the body, some changes, physiological changes happen, which increase the heart rate and the blood pressure. And if you are not capable, if you are not adapted, so actually you will succumb to those things and the patient may die. So physical activity, if you are doing it on a daily basis, so that helps you in preparing your body to take those circumstances, those adverse events in your life, say in a healthy manner. So what I mean to say here is that sympathetic activity, what I told you, increase the heart rate. By exercising, you are actually increasing your parasympathetic activity. So parasympathetic means that your heart rate may not go that high, your blood pressures may not go that high. For example, athletes, so they are trained, they are well trained. So what happens when they are running? So they are not going those physiological changes what I or say normal people do. So they are able to better adapt to those changes in the physiological things when they happen. So this is how these things are related.
This is a very important thing, I think, what you have told, because all of us at some point of time in life do have, to encounter such stressful events, and if we are, our body is already, having tolerance and well prepared for it, then it will really help us, in dealing with the unforeseen circumstances and the stressful events. Now we come to the most dreaded and one of the most talked about non-communicable disease, that is cancer. Can physical activity also really help cancer?
So you see, these two things seem to be very different. How an exercise can prevent cancer? Of course, diet, someone can say that if you're eating bad or something which has changed my stomach, or that might. So, again, this is a very important thing, and we must realize it, that physical activity can prevent certain cancers like cancer of colon, breast, and bladder. So, there is a mechanism in the body which is known as inflammation. So, inflammation is something where this process helps in the cancer cells to grow more, and by physical activity we decrease this inflammation is decreased, and as a result the cancer cells find it difficult to grow. Another way is the hormones, which you already told and we discussed, that certain hormones are there in the body which cause the cancer cells to grow, and by way of physical activity those hormones are suppressed. So in nutshell, physical activity by various mechanisms, they help us to prevent cancers, and if cancers are developed, it will retard the growth of the cancers.
What you would like to tell about various types of physical activities?
Right. So I think this is also what we should know. Physical activity can start from walking. Anything can be a physical activity, as we discussed, that if you are moving your body parts and which is going to cause some energy expenditure in any form, it is a physical activity. So if we have to summarize what are the physical activities, it can be as good as an aerobic activity. You can walk, you can run, we can cycle, we can swim. Then there can be some strengthening activities like weightlifting and resistance exercises. Then yoga is a very good thing. Some people may say that is yoga also good physical activity? Yes, it is. If you think that parasympathetic activity has to increase and you want to certainly prepare your body for future events, then I think yoga is one of those things which can prepare your body for all those, including medication. And then there are recreational activities like dancing and sports. So all these are the physical activities which as per our routine, as per our ability, we should adopt in our daily routine.
So I think one very important thing you said, that as per our ability, and as per, I would also say, advised, because after our session and this lesson, everybody should not think that we should vigorously do physical activity irrespective of whether we have some ailment, whether some disease or not. There could be in certain conditions that some physical activity can also do harm. So for example, if you have joint problems and you start climbing so many stairs every day, or if you have some cardiovascular problem, you start running irrespective of whether you're having angina or pain or not. So those things are I think also important to be considered.
Yes, you are quite right. If you are suffering from a disease, like you have mentioned about cardiovascular disease or say blood pressure or maybe something which is life threatening, so it is better to consult your physician or a doctor, and then accordingly what he suggests, you should do the physical activity. But physical activity including walking is generally acceptable for any disease. So now, what should be the say duration of physical activity if we talk in for a normal population and someone who is diseased? So ideally, the guidelines here that at least 150 minutes of moderate exercise, more than some normal walking. It should be something like a brisk walking. And of course, if you can run and jog, it will be good. So that 150 minutes of this exercise per week. So you can split it over a week and you try to adapt this thing in your daily routine. And children, if we are talking of children, children actually does it more than what we do, but minimum at least 60 minutes of daily activity it is recommended for them. And some strength training, if possible, it should be included in it, like some sort of resistance exercises if you can incorporate. So they will actually help you in building your muscles and prevent the risk of those diseases what we are talking.
So you have said about recommendations. So do we also have some standard recommended guidelines, or is this okay, 150 minutes?
Yeah, this is actually the standard guidelines which WHO is suggesting and asking us to follow it. You can of course do it as per your body, what body allows. But this is something 150 to 300 is something which is really going to give you benefit. You can briskly walk. That is something which we can adopt. Like daily, we all know that we are coming to our office or going to our work. Even just leaving those cars and using public transport, moving to the public transport, taking the stairs in your office, avoiding lifts. So these are some small activities which will contribute to your physical activity.
Yeah, you mean we don't really need to always take out time, to decide, okay, all right, from 5 to 5:30 or 7 to 7:30 we'll walk. If we don't have the time, these small tips will also be useful.
They
Like
will
you
be
said,
added, yes.
yeah, like you said, taking a flight of stairs or at least coming down the stairs, not taking a car till the, if you have to go from one building to another. So that can be really done.
Yes, ma'am.
Okay. So I think a lot of information you have given and a lot of useful things we have learned today, and I hope everybody will now realize what is the importance of physical activity. Not just physically, it is helping in the preventing diseases, also in keeping the diseases in control. Like you said, even the heart diseases, it helps to keep your heart strong, open up, as you said, many of the vessels, so that we don't have chance of future heart attacks. Then again, in diabetes, you said it will help in preventing complications, preventing diabetes as well as helping in preventing complications. If there is stress, if there is depression, again in that case also it helps to prevent the so many diseases. So anything else you would like to add? Or
So just walk and do some physical activity. So that is the message. So that will prevent you from getting diseases, keep you healthy and keep you fit, keep you away from anxiety, depressions. You will have a good sleep.
thank you.
Thank you, listeners.